A question I receive every day is, what are the different options we can do for our lips? And I think everybody knows that you can use Botox and you can use fillers. And we all have that fear of, if it's not done correctly, if it's overdone, people get kind of what they call that duck lip, where it protrudes and it looks unnatural. And also, the upper lip really should not be a larger volume than the lower lip. Typically, the upper lip is about 2/3 the volume of the lower lip. But what people don't think about is gravity. I like to joke, but it's true. Gravity never goes to sleep at night. So what happens is, we all know how our face will sag and we'll get kind of boxy and our lids and our eyebrows. But what people don't think about is their upper lip also will stretch and sag, and it will cover your teeth. And then when it covers your teeth, it makes everything look kind of old and aged, even if you tighten the rest of the face. So a common procedure that's done is to shorten the height of the upper lip, and that gives a more shifted proportion to the face. And it also allows someone, when they're talking, when they're smiling, to have a little bit of tooth show. And if you don't shorten your lip when you do the rest of your face, it's going to be out of proportion. So that's something that I always like to talk to people about. If their lip is long enough that it covers their teeth, or sometimes they'll say, I don't feel like I have my smile like I used to. And the way the procedure is done is to hide it in the little nooks and crannies right around the nostrils. So all of the lip is not altered at all, but it shortens the height. And by shortening the height, it gives you a fuller lip and a little more tooth show. So that's the upper lip lift that we do at Oculus. It's a procedure that is a fantastic add-on if you're thinking about doing something around your face to give you a rejuvenated look and even a prettier smile.